Hi there. One second. Centennial, an early warning system to detect and track the next pandemic by Bryce Christensen. The TED Talk I chose was called A Virus Detection Network to Stop the Next Pandemic. It was by speakers Paradis Sabeti. She's an infection disease researcher. She investigates the genomes of microbes like Ebola and coronavirus to understand how to slow them down. The other speaker was Christian Happy. He's a molecule biologist. He's a powerhouse of scientific leadership in Africa. Christian Happy sequences and studies infectious diseases like Ebola, HIV, and coronavirus. There's the link to the TED Talk I posted below. You can go click on that and watch it if you would like. Centennial, the definition of centennial is a soldier or guard whose job is to guard something. It is built on three major pillars. The first pillar is detect. It allows them to identify viruses, even those they've never seen before, track them as they spread, and watch for new mutations. And now, with the more powerful gene editing technology, CRISPR, we can use this genetic information to rapidly design sensitive diagnostic tests for any microbe. Tools that help Centennial. One of the tools is called Shermlock. It can be used to test known viruses on simple paper strips. It is very inexpensive, and frontline healthcare workers can use Sherlock to detect the most common or most threatening viruses within an hour. And the other tool is called Carmen. It requires a lab, but it can be tested for hundreds of viruses simultaneously. So a hospital lab staff can test patients' samples for a broad range of viruses within a day, making it a lot faster. The second pillar is connect everyone and share this information across the board. Healthcare community. In most outbreaks, they're pretty bad about sharing the information. Hospitals are. So they've came up with a system that makes tracking an outbreak through space and time and corners. It makes it difficult. So they've come up with a system that's developing a cloud-based system that mobile applications that connect community healthcare workers, clinicians, public health teams, everyone. This allows them to upload data, perform analysis, share insights, and coordinate a response and action plan in real time. The last pillar is empower. An outbreak surveillance system can only succeed if we empower frontline healthcare workers that are already out there taking care of communities. It requires a lot of training. The two speakers, they are very aware of this. They have spent the last 10 years training hundreds of young African scientists and clinicians. Over the next 5 years, they will also train an additional 1,000 healthcare workers to use centennial detection tools and empower them to train their colleagues. This way, we will improve the original healthcare system and integrate surveillance into medical practices. Centennial, at the end, it's the whole idea of Centennial is that we all stand guard over each other, that we all watch over each other. Each one of us can be a Centennial in a way. Being able to monitor what is making us sick and be able to share that with the rest of the community is huge. Letting that information known throughout the community is the first step in slowing the pandemic. Thank you.